So when Harrison was about 4, he had some teeth issues. We we had to. It took us a while to get the right dental plan for him, and in that time, some of his teeth got worse than they were at the beginning of it, and so he had to have some sedation on a trip to the dentist. And I don't think he had ever had any kind of sedation prior to that, and he came out of I think they had to cap some of his teeth. Came out of the appointment, and he was like a drunken soldier, a drunken sailor, or whatever you want to call it. And me kind of flopped down onto and he was talking, and I think he even said something like, "I really love you, Dad," and he was just really uh, flopping around and real loose about himself, just from the sedation. And it was just a funny situation to see him in that place, that because he was a very, most of his dental appointments, he wanted to know what was going on, how things were going. And this one, he was just as loose as a goose for. Um, uh, it was just a humorous point of time, having to see him under sedation, for a kid that was very, oh, how would you say it, kind of structured and all, you know.
Yes, yeah, I don't know how to describe it, but because he certainly had his silly side too. But
Yeah, but he did have a silly side to him. He was very good at humor, but he was also very structured in the way that did stuff. So this was a different way of seeing him, and it was kind of a neat way to see him in a way. But anyway, hello, this is Don.
and this is Gina with Focused Healthy Family. This is podcast number 136, and today we're talking about our bodies, medicine, and more.
And I start that story out just to talk about, we're going to be talking about um, medicine, with how much people are taking, what different things are happening because of the amount of medicine that we
Side
take now, the
effects
side effects.
and how the medicine is what it's designed to do, in our body. What is it? What are the actions of it? And
Well, what kind of got me thinking about it, you and I talked about it yesterday, listening to a podcast on the way home from work yesterday, and they were talking about this subject, and a person called in on the podcast and was talking about their kids being teenagers. I think the age they were about 16, and they were talking about the expectations of experimenting with their kids. Should they, how should they handle that? Because they just knew that kids of that age would be experimenting, and it started making me really think about, is that really true? Should we be looking at that as a just something we expect them to do at a certain age?
yeah, and you and I got talking about this because we looked at our own kids who have, I mean, even our two kids who are old enough to drink don't. They choose not to. And looking at, what is common, what is expected, how do we approach this? I grew up in the just say no era. Is that really effective? Um, I would argue it's not, and I'm all about information. And what we do expect from teens is experimenting and pushing boundaries and figuring things out for themselves. So that can look very different. And I know we've talked about just our whole journey with unschooling and approaching parenting from a different perspective outside of the typical authoritarian, do what I say, this is what you're supposed to do, follow all the rules. When we put all those expectations and those rules on our kids, when they're wanting to experience their freedom, when developmentally their brain needs that, their pushback can look like engaging in alcohol and drugs and going along with peers because they feel constrained by the rules and things. And yet The cat is pawing at my arm with her claw and it hurts. And
Meow.
um, you know, when kids don't feel that push, when they don't feel like the rules are such a burden and so strong and so heavy, it's like at our daughter's high school. Our youngest is now in high school, and the principal says, your kids are going to lie to you. They're not going to tell you the truth about their grades and things. And I'm like, not our kid.
Well, yeah, and that's
She comes home, she's like, oh, I didn't do well on my test. I missed two questions. I got a 96. And, you know, we have a different experience, but we've also facilitated an environment of open discussion and conversations and um, just talking about these things. And, you got me thinking about, there's the, tell your kids no drugs, tell, okay, your kids are going to experiment. So then have conversations. It's like, what about educating them on how their body and brain works and what these things do to our body and brain so that they can understand?
well,
Because they are going to make their own choices. They're going to be in situations where they make their own decisions. And don't we want them making informed decisions?
well, and they talked about there, and I think this is part of that is that we set up this, and they kind of talked about it as a linear vision of what our kids should do. They're going to go to school, they're going to go to college, they're going to graduate, they're going to get a good job, they're going to get a house, they're going to get married. We kind of put that
Those are all expectations we're
expectations
putting
on
on
them,
them, pressure.
and along in that path is the thought of experimentation and drinking and whatever. And that's like I said, well, and that's as I was coming home yesterday, I kept thinking, we don't have that problem. What 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 did we do differently, or how did it, you know,
Well,
we end up in this place? A lot of it I know from my own growing up. I didn't grow up around alcohol, a lot of my parents. They they once in a great while they would have a drink. The highball was their specialty, or my dad would have a beer, but it wasn't every night. It wasn't a cocktail after dinner. None of that. It was rare moments that they did it. And I think you kind of or not, experienced kind of the same, somewhat same kind of situation too. You didn't see it a lot around your house.
no, no. And yet I had that experience of going off to college and wanting to escape and,
Yeah.
and um, I I didn't drink alcohol till the end of my freshman year. And it helped me relax and chill out and
Yeah.
get out of my kind of tense, high strung nature. And um, I was a happy drunk and I was just felt more at ease, that disinhibition that alcohol causes. But I also, my parents had great parents.
Um,
And yet there was those expectations, I remember growing up and college was what came after high school. It was not a choice you made. It was just what happened. And I didn't feel an excess of pressure myself growing up in the 70s and 80s. And yet I know the intensity of academics and outside activities has increased since I was a kid. And you talk about, the developing brain and going through puberty and being in those years before 26, 27, our brain is still developing. And yes, experimenting and trying new things are part of that growth, but it doesn't have to look like drugs and alcohol. So our son had his first Subaru, well, it's his second car. And he liked to go to the beach and he loved driving this Subaru. And how did he experiment? He drove it out onto the sand and got stuck. That was him pushing the boundaries. That was him testing the limits with his, car. And his friend had to push the Subaru out of the sand. So, it's not that our kids don't feel the need to do different things and try different things, yet, I mean, for us, we haven't had that experience. And if our kids were wanting to drink or finding themselves in those situations, I'd want to educate them so they understand. And I know, um, I mean, our middle child, she researches and studies and
Yeah.
understands things that, the problem right now, it's like when you were in the 70s, pot, marijuana, it was common and essentially not as harmful as alcohol, in my opinion. Yet now you have to be careful that they're lacing different things with, I believe it's fentanyl, and how deadly that is. And so you don't necessarily know what you're getting with that. And it's like they wanted to reduce cigarette smoking, and now there's these kids vaping, and they've discovered that the damage to the lungs is far worse with vaping than with regular cigarettes. And so understanding these things, educating, knowing, how these medicines affect the body. I remember an occupational therapist. I was at a summer job at a state hospital. So this would be a psychiatric facility. And I was there working in the activities department as an employee for the summer. But there was an intern, I believe, she actually was from my college, and she did a whole presentation on tobacco and cigarettes and the positive effects of them, which was very interesting from my perspective. And just talking about, the things that nicotine does, it controls appetite, and it does have these effects that can be helpful in some degrees, right? But now we have this bigger problem of vaping. It's like, okay, I'm not smoking now, I'm vaping, but it's doing twice as much damage to lungs. And so, it's understanding, okay, this is why people do this. It's not just because it's something bad and they're just making a bad choice. It's like, well, there's a reason behind it. There's, the addictive properties, there's the effects that they like getting, from it. And understanding that, I feel like education, it's the key, right?
Well, and it goes into that, it kind of leads into some of the other thoughts that came to me yesterday was, we're talking about the effects and learning about the effects, but also, it brought up in my mind my own mother, who was um, at one point ended up in the hospital. I think she had started having small mini
Well,
strokes
she
and
had a
things,
heart attack.
and then had a heart attack. And luckily my sister, who was a nurse practitioner, was able to review the different medicines that they had been on, and found that there were a couple of different medicines that were actually working against each other and actually starting to destroy her liver. And I think that was part of what led to her eventual, death, was the fact that she was slowly dying within because of these interactions between the drugs. And I found this. Let me see if I can
Well, and
find
on
it.
a note, your sister advocated at some point, we took her off all her
Hmm.
medicines, and
Yeah.
there was a little bit of a period she actually did better for a while because of those negative effects of side effects. And that, you know, and luckily all of you guys, your brothers and your sister were all in agreement to do this because you had other family members questioning, oh, her heart's not functioning. She needs to have a pacemaker put in and she needs this and this. And you guys chose differently and found that, then she didn't have all those negative side effects to improve the quality for the short period of time that she still lived.
Well, and um, yeah, this statistic kind of caught me when I was, because this is from Consumer Reports. I looked at CDC, Center for Aging, so because I wanted to look around at different statistics, because I'm always curious of some of these, whether they're influenced by the drug companies, so they're not going to show the extremes. But the Consumer Reports came up with this: 53% of those taking prescription drugs get them from more than one provider. And then if you think about that, these providers don't always communicate with each other. And that, I think we've seen that, scenario in different cases. Um, and so you think about that, they could be prescribing drugs that they don't always check on the other drugs, because one of the other 35% of the healthcare providers don't check up and update medicine for people.
Hmm.
So you could be having one prescriber prescribing something that contradicts with some, and I think we've seen it with the Parkinson's medicine, with sometimes where they were giving your father drugs that interacted with it in a not a good way. Um,
Yeah, and I mean, some places have gotten better about this. We have two main hospital systems in the greater Charlotte area, and they've finally gotten on board where they can share information between the two. And some doctors are better about making sure they have an adequate, updated list of all those medications. And are they really researching it? Are they making sure that there aren't things that have contraindications? I know when you go to get it filled, a reputable pharmacist will flag anything that has possible side effects. And I know we've talked about it with my daughter's psychiatrist because she looks it up. My daughter does and says these are not supposed to be taken together. And she talks about the benefits versus the risks, of things like that. And but yeah, but not everybody is aware of this. Not everybody has doctors that are looking at the whole picture because things are so specialized now, right? I love it. I don't love this, but they fall and break their arm and their leg. One doctor operates on the arm, another on the leg. So not only do you have orthopedic doctors for bones, neurosurgeons for brain and spine, um, you have different orthopedic doctors for different, joints in the body, especially the larger city that you're in. Someone who does a hip replacement doesn't necessarily also do a knee replacement. And so we've compartmentalized people into body parts and systems. And what about the whole picture? What about the overall health? Looking at the pros and cons of things, because sometimes the negative effects of a medication far outweigh the benefits. And sometimes, it's the other way around. Like, okay, you know, um, yes, it can have these side effects, but without this medicine, this can cause this problem and this problem and this problem. And we know that, Don, we've been big proponents of natural health for some time. And yet when you had your heart attack, you were on prescription medications and we were grateful for those. And yet, as you were recovering, you worked with a naturopathic doctor and, okay, what do I really need? What do I don't need? What supplements can I take that will have similar effects? And let's see if this is effective for lowering your blood pressure, right? And if it's not, well, then you'll take a pharmaceutical, kind of balancing it, but looking at it as a whole picture, understanding the body and how it works, I think is so important.
Well, that was one of the things I was going to say about, people are going to have what I think what we're kind of talking about here is we need to advocate for ourselves and for our loved ones. And one of the ways to do that is getting with a naturopathic doctor or a holistic
Holistic doc,
doctor
integrative
because
health doctor.
integrative, all, any of those different, because what Dr. Smith did for me at the time when I came out of my heart attack was he sat down with me and he said, okay, here's what your cardiologist I think is trying to do. These are this medication, this is what he's wanting to do with it. And what he gave me was the option of I could possibly do this with this supplement or this procedure or whatever. But it was all, luckily and this is where you want to find a naturopath that's very open to this. He didn't say you have to do this my way. He said it's your decision. I he never uh, dissed my cardiologist or any of that. He just gave me the options that that worked for me. And and there were some medicines he actually said, no, I think you should be on this. I think you should stay on this one. This one is one that is working and you need right now.
Well, and there
So
were also, one of the medicines was to slow your heart down so it didn't have to
yeah,
work as hard. And that he felt was contradictory.
yeah,
Like there were areas where he disagreed because naturopathic medicine, and I'm trying to, um, they actually, a certified naturopathic medicine goes to a 4-year postgraduate. So they've been to graduate school. They go to a 4-year medical school to study naturopathic medicine. And um, it's a system of primary health that emphasizes prevention and self-healing process through the use of natural therapies. Naturopathic doctors, NDs, are trained as primary care physicians in a 4-year postgraduate medical school, blending centuries-old knowledge and wisdom of natural treatments and diagnostic modalities, along with the rigors of Western modern science. Steeped in traditional treatment of healing methods, principles, and practices, Naturopathic medicine is centered around a holistic, proactive, prevented, coupled with comprehensive diagnostic and treatments. And so they look at the underlying causes of disease. I remember either Dr. Smith or someone else, I listened to a web, not a web, it was before the internet, but it was a naturopathic doctor who was talking on health. How to work with the body to help heal it. Some of these pharmaceuticals out there are not really working with the body. They're just kind of fighting symptoms. And as you know, and naturopathic medicine doctors sometimes, in the problem with naturopathic medicine is not every state allows for certification. So you get people calling themselves naturopaths and they haven't been to naturopathic medical school.
Yeah.
But there are doctors who've gone to naturopathic medical school. And like I know our doctor that you speak of that you work for in Arizona, he could perform small minor surgeries and he could do prescribed medications and do other things because of the licensure laws in that state. Yet here in North Carolina, we don't have that. But that doesn't discount his knowledge and his
No.
experience and his abilities, right? So, to me, that's the big difference is working with the body, helping the body to heal naturally, getting to the root cause of things, really, digging deep and not just, treating symptoms because you're really just covering up. You're not, they're going to manifest in other ways. And yeah, medications are needed in many situations. And we also need to educate ourselves on how those are going to affect us and what side effects can be. And sometimes things have side effects that are not listed. In the list of side effects. Just because it's not one that's typical doesn't mean it isn't affecting you in that way because all people are different and all people can be affected differently. And, I think the most important thing, one of the most important things we can help our children to learn is for them to understand their own body. Our teenager is in a health science class, and she says there's students in there who want to go into a health science career, but she's like, there's also a lot of athletes in there that want to understand their body and how it works. And I'm like, isn't that something we all,
Yeah.
really, we are all in these bodies. We have these meat suits, as my friend Helen calls them, and we need to know how they're working and the different things we're doing and how it's affecting it. Because if we just complain that we're tired, we don't feel good, we're achy, or we accept this as normal, it's not. Even if you're 80, to be tired and achy and exhausted.
Well,
Um,
here's a good why that might be happening too. And this is, I thought this was this is from the Center for Aging, and it was a study they did um, from starting at the age of like 50, 75% of people are on prescription drugs, and the average amount is 13 different drugs. Then it jumps up to my age, 65 and older, 87% are on prescription drugs and they're doing at least 20 medications on average. And then you go 80 plus 80, it's up to 22. That's a lot of,
and there's a name for that. It's called polypharmacy, and it puts you at risk for so many more things to be going on. And so my dad is recently on a hospice. And I've had someone like, oh, I'm so sorry to, and I'm like, I'm not sorry. This is someone who's going to, we've got the nurse practitioner, we've got the nurse, we've got people who are there promoting his comfort. He's still getting his Parkinson's medications. He's still, um,
one, he's not,
doing what he can. And, I love that they look to minimize things. The doctor, the nurse practitioner, who oversees his medications, met with us today and said, she's a big advocate of vitamins and minerals and things. She goes, they're designed for long-term health. She goes, when someone's on hospice, we're not looking at long-term health. And anything you take can have some degree of side effect, even if it's just upset stomach. And the less things they're taking, also when people have swallowing issues, you can choke on a pill, it can cause
um,
aspiration and other things, and just the less you're putting into the body, it's taxing on the system to have to deal with it. Um, and it's so much better to get vitamins and minerals from food. Anyhow, I make my dad smoothies and bring to him, which he loves. I put spinach, frozen spinach, um, coconut water, some almond milk. I have these nut pods with like a coconut creamer, but no sugar added. I've been using frozen cherries. I love cherries. A little vanilla almond milk. I have protein powder that is just collagen powder. Yes, it comes from cows, but it's not dairy, it's the bones.
Mm.
Um, but if you're vegan, you would want to choose something else. But if you can't tolerate dairy, you can take collagen powder. What else do I put in there? And you blend it
Well,
all up, and with all that cherry and a little bit of vanilla flavoring and the almond milk, the creamer, it's yummy and it's sweet, and yet it's packed, it's got nutrients in it. And he drinks it up.
and you put some love in there.
Yeah.
And you talk about hospice, and your father's not necessarily on deathbed. And I think
Well, and
most
what
people get this kind of idea that hospice is the very last moments of life kind of thing, versus
well
they're
they
now
they
really set
say
up.
6 months or less, you know,
But I think they've
but
expanded that.
well, and I think it's sort of there as the parameter, but like I know when we met with the first person, they're like, we really can't predict. I mean, I could get hit by a car tomorrow and die. We're all heading towards death. It's what eventually happens. We are not immortal. And when you're 82, 83, how old's my dad?
83, I think, isn't
83,
it?
and you've had Parkinson's for 18 years, and now you have dementia, and you have other things going on. Kidneys, not his kidneys are okay. It's his enlarged prostate that he has to have a Foley catheter now, right? There's different things going on that are causing a negative decline in his health, and the quality of his life has
Oh
gone way
yeah, say
downhill.
he's
So
in
who
pain,
knows?
and yeah,
Is it a month? Is it 6 months? Is it a year? Yet the focus of hospice is comfort, comfort measures. We're not treating a disease. What can we do to minimize his discomfort, to maximize the quality of his life? And, um, it's a positive thing. It really is. And then they're providing a nursing assistant to help get him a bath. So he would get that from the staff normally, but from the staff there, they got 14 other people they got to also worry about on the unit versus this person comes in just to help my dad twice a week get a bath. And she can focus solely on him. And because they're trained in hospice, they have some extra training and knowledge. And she was really patient and really took her time. I kind of stepped back when she started, but she was washing his face and asking him how it felt as she helped him like clean the inside of his eyelids and things, right? It's not just a quick splash, splash,
yeah, yeah.
spit bath, or there's different terms for these quickly washing up. Um, and
So
so just that extra care.
yeah,
And, people don't realize how beneficial that can be. I've seen people working in these rehab facilities and nursing homes and whatever setting it is, assisted living. The family's like, okay, we're going to go on hospice now. And yet, this person could have gone on hospice sooner. They could have had these additional resources and support, but there's unfortunately a stigma, with it. And the biggest downsides, in my opinion, is Medicare will not pay for therapy services and hospice at the same time.
yeah.
And that's unfortunate because I know that's a big reason people hold off. Because therapy services can be just about getting someone up and walking, someone who's not safe to walk unless there's a skilled person with them, or, helping them to be able to do a little more for themselves, whether it's finding adaptive equipment for feeding themselves or, helping with their swallowing or whatever the issues are, speech language pathology, as well as physical and occupational therapy. Um, but the way it's set up, those are not allowed for reimbursement. So it doesn't mean you can't pay privately for additional services. Um, but other than that downside, we're really happy to have this extra help for my dad, these extra attention and care because we don't want to see him in pain. He has chronic back pain. He's had two back surgeries in the past, and he can no longer move around the way he used to help eliminate that stiffness by moving. Um,
So
and so that getting this support, getting this help, and so it's kind of help. It's another eyes on to look at this picture. And so, in the context of looking at medications and how they affect our body.
there you go. Yeah, I was kind of bringing us back to
Yes.
the idea here, because it's well, and I guess too, it's the idea of advocating sooner than later, too, as far as, if if we would have caught some of these different medicines earlier with my mom, would that have made a difference? And so it's paying attention to it. Not necessarily, we're not, I don't think, advocating here that all medicines are bad,
Yeah.
but that you have to really watch what you're getting, what's the effects of them. Are there combinations that aren't working? All of that kind of stuff you have to pay attention to. Educating for kids when we're talking about the young side of this, you know, educating them on what what's the effects of different things that they do. Um, I don't know. Do you bring I'm going to pose this to you, Gina, is like, do you bring the subject up with your kids ahead of time if they're not in the experimenting or whatever? You, how do, I guess we were just open about conversation. Plus, I mean, we had situations with our kids with, the different, with OCD and things like that, that kind of made us talk about it. Um,
Can you hit pause? So, as far as talking to kids, I think it's important to kind of follow in their lead with where they are. And this is true in so many areas, whether it's death or other things. When your kid comes to you and says, why does grandma smoke? Or, if someone passed, where did grandpa go? Letting them steer the conversation. And one way to do it is, well, why do you think grandma smokes? Well, I don't know. I don't. And you can say things like for me, my grandmother would be, when she started smoking, nobody knew it was harmful. Um, and that information was not shared for a very long time. And so it is addictive and it's really difficult to stop. And um, helping them to understand, well, what people do it because of peer pressure. I've heard of people who are social smokers. They only smoke when they're around other people. And it's like, is that a bonding experience? But these are the types of situations that kids can find themselves in when other people are doing it. They want to, join in and be part of the crowd, which we tell them not to. And yet, when they're young, we tell them, go play with the other kids. Look what the other kids are doing. Join in with them, participate with them. Here, go to preschool, go to school, be around your peers. And then, all of a sudden it's like, well, don't do what they're doing. So, how we introduce our kids to other people and how we talk about it. If you just say, no, we don't do that, we don't talk about it, you know, it cuts off conversation. And we also don't want to spell out, a whole lecture on how the body processes medications and alcohol when our kid is, you know, 11 and just overwhelmed by these thoughts and ideas, right? If they're inquisitive, if they want to know, you can say, well, we could look up this information together. You can find child-friendly resources on different things. I know I did this when our older child was dealing with mental health issues and wanting to help her peers who were young, they were preteen, understand what was going on with our daughter and help them to understand mental illness in a way that was appropriate. And I know I shared resources with some friends, the parents of these kids, and even my brother with my niece and nephew who are close with my daughter, and um, to help them understand it. But again, on their level. And if you hear things going on, just bringing it up in a gentle way with your kids, just and this is where being open and letting your kids be able to share with you and listening, no matter how difficult it can be for them to ramble on and on and on about different things and different issues, don't you want to be that sounding board when there's something,
bigger
really
than that. Yeah.
serious that can really affect them? And respecting that when they're younger, the things that they come to you with, they're serious to them, and respecting them to take it seriously. It may not seem like a big deal to you that their best friend said or did this, but to them it is a big deal. And by when we start dismissing them, well, no wonder they're, well, mom says this is bad for me. I'm going to do it. It's that pushback. It's that, well, they're telling me I can't. Well, that makes me, want to do it more.
Well,
So you're creating a situation to enhance that. And that is part of the brain to push, to test limits, to test boundaries. That is part of the growing brain. And yet it can be done in an environment where they don't feel like they have to escape from the
Well,
situation.
yeah, they kind of talked about this on the podcast that the mother that preaches and preaches and preaches and tries to teach constantly teach them, putting more info that the kids are going to not going to want to approach them because oh my God, I got to go through that,
They're going to tune it
or
out.
they're going to tune it out. Yeah, it's going to be the Charlie Brown teacher, kind of thing.
But
But
you can
yeah,
share information. You have an older
yeah,
teen, you're concerned about their friends and they're hanging out. You can send them a link on some information and resources on
but don't bombard them with it,
effects. No,
because
and open
it's
up. Say, I'd love to discuss this sometime. There's different movies or TV shows you could watch where it could kind of become part of the natural conversation. And doing a lot of, oh, what do you think about that? And really being quiet and not pushing your opinion on them, but getting them to speak up and hearing their way of thinking about it because it's going to be different than what we think it is. And maybe a logical way for us to approach it is not what's going to make sense to them. And so, really engaging them in that conversation and hearing their opinions on it, hearing what matters to them. So, we need to think about what we're putting in our body, whether it's food or supplements, medications, looking at drugs, recreational drugs, alcohol, and how these affect our body, and realizing, we need to look at this with our seniors as
yeah.
well. And, Parkinson's, it seems like it's a more common diagnosis, just in my professional experience. And I've learned so much more about it just because of my dad having it. Yet, as wonderful as the medication is for Parkinson's, carbidopa levodopa, that helps counteract the effects of the lack of dopamine in the brain, causes we call freezing, the body's inability to move
Mm.
forward and follow through. So these medications help that with that cycle. And yet, this is coming from Parkinson.org UK, side effects of Parkinson's drugs, dyskinesia. So if you know Michael J. Fox and these are
Movement.
dyskinesia movements, that's a side effect of the medication. And he talks about it. If he doesn't take it, then he's frozen, then he can't move. Hallucinations and delusions are a side effect of the medication for some people. Impulsive and compulsive behavior. There's warnings about gambling. I've recently dug into obsessive compulsive disorder component with Parkinson's and possibly a side effect of the medication. I see this behavior in my dad. He's suddenly worried about things being messy and wanting things neat and organized and behaviors he did not have at all before. And so these are obvious. These are out there. We're aware of these things and what other medications, what side effects can be happening. And sometimes we say, okay, the benefits outweigh the risks, but it doesn't have to be forever. There was a point where we had to cut back my dad's Parkinson's medications because of his delusions and paranoia and feeling like someone was out to get him and he was darting out the front door and running across the street. And yeah, he was mobile, but this was having a negative effect on him. And so things are not black and white. So having conversations, learning about these things, really sitting down with someone who can go through the whole list of medications that your loved one is on to understand.
Well, and when you talk about Parkinson's, you I know of Rich, the gentleman who talks about Parkinson's that I've known for quite a while. He took a whole different path with the way got treated his Parkinson's. He's done some Eastern
Medicine.
medicines and things like that, and he's done a lot better with his Parkinson's. So there are other options too. There are other things to think about. Not saying that that's the right path for anybody in particular, but
There's
that
links with gluten,
yeah.
gut brain health and Parkinson's. I mean, there are so much information out there. And it's worth considering because this is a long-term, typically slow
Mm.
progressive disease. And, are there other things that are causing symptoms to be worse that are affecting it? And, wouldn't you rather change your diet than know that the medicines you're on to help you now,
Well,
10, 15 years down the road are going to cause all these other problems?
or stop being effective.
Yeah, you
That's a
often
big
have
thing
to
with
increase and
yeah.
the dose of it, which is why Michael J. Fox has so much dyskinesia, is he was diagnosed in his 30s. He's been on the medication for so long that over time you have to increase it for it to be effective. But the
really causes worse.
the dyskinesia,
Yeah.
the random kind of movements of the body. So, it's important to learn, to research, to find more information. And I really think it's important to advocate for our children,
Mhm.
to do this as well as they're looking at what they're putting into their body and how things are affecting them without sounding like a nag or, you know, saying it so much that they're tuning you out, right? But opening up for conversation. And, when we did parenting workshops, my favorite thing to tell parents is to shut up and listen.
Yeah.
Sometimes we need to just, they don't talk to me. Well, do you ever give them the space to talk? And that doesn't mean like, okay, tell me about your day and pausing for 30 seconds going, okay, fine, you didn't tell me anything. Why wouldn't you talk to me?
Or or laying out your day with so but
Giving them space, respect. It's all about
yeah.
respect, respecting each other, respecting our bodies. And if you're working with a loved one, you have to respect what their desires are.
Mhm.
Maybe they feel it's so important to follow everything the doctor says and take these medicines. And if that's so important to them, then we've got to let go. We've got to uh, come to some acceptance of different people's awareness and understanding and ways they want to do things.
Well, and and you, as you say that, understand that they still can be in there and taking in what you're saying and understanding it, but they may not be able to be able to express it. You know, uh,
Oh, you're talking about
well, just
sometimes
understanding that they aren't
someone with
necessarily
dementia,
always
someone,
so far out of it
okay,
that they're not catching what you're.
okay. So someone with dementia,
Oh,
um,
well,
you might think that they don't understand anything that's being said. It's like
yeah,
today, the nurse practitioner was there and we were going over the medications with my dad in the room. And there was a time when we had to be careful about this because of his delusions and things. And yet at this point, I realized, you know what? It's good that because he knows that me and my mom are taking care of him and he has a level of understanding of that. And so it was nice that he was right there. Could he process it all? No. But I'm sure he took in some things and some information, and that's something that's just important to keep in mind in general. Even if you think someone is maybe they don't speak, they're not verbal, it doesn't mean that you can't still talk to them.
yeah.
So
So that's our podcast for today. And we really appreciate you listening and hope that you really enjoyed it. And if you did, first of all, we'd love to hear from you, hear comments, suggestions. If you're somebody that would like to be on the podcast, and we could do an interview with you, whether you're going through this yourself or you're a practitioner that's dealing with this, we'd love to talk with you. Um, Also, hit subscribe from wherever you're getting the podcast from, so that you can be notified of each month or each week. Then we get this. You can check us out at our Focus Healthy Family website, focusedhealthyfamily.com, because Gina does consulting. She can help you through this journey that you may be
of
going through with
caring
your
for an
parents.
aging loved one.
And we can answer questions, help you, and like I say, guide you. Uh, we're on Facebook at Focus Healthy Family. We're at Instagram with Focus Healthy Family, YouTube, all the different. Um,
And if you're listening to our podcast, you can listen from wherever you listen to podcasts, but you can also see and hear our podcasts on YouTube. That's also where we do our Ask the
oh,
OT.
tube.
Yes, I'm thirsty. HO2. Ask the OT.
And our next Ask the OT happens to be October 9th. It's a Wednesday at noon. We also have one on the 21st of October at 7 p.m. And then, of course, I also do my free tapping groups each month, and my next one is coming up. Well, actually, it'll be before this podcast comes live
So
because
once
it's
a
tomorrow.
month, you've been doing them, Don?
Yeah, so I'll be.
Go to the
If you go
website.
to the website, you can look and see about the group and sign. What I'd ask you to do is register so that you'll get each month you'll get a notification of the different times for that month for that group, and again, it's free. So we'd love for you to take advantage of that and get some tapping work done to help ease anything that might be going on, the struggles that you might be going through. in this journey that you're taking.
Thank you for joining us. We hope you've gained some information. Please share it with us, with others. And remember, how we speak to our children and our loved ones today shapes their future and ours.